Hi everyone, welcome to today's live stream. I'm Dr. Sylvia, a general practitioner with AskAwayHealth. I'm so glad you're joining me today. We are talking about heavy menstrual bleeding. So we're looking at some assumptions that people make about heavy menstrual bleeding and just trying to debunk them and say what the truth is about heavy menstrual bleeding and how we should treat it, how the different causes, what you should do, when should you go to your doctor about heavy menstrual bleeding. So we're going to start that in a couple of minutes. Before that, how are you? How's your week been? How have you been getting on? I hope you're well. I'm looking forward to the weekend. Please give this video a like if you come across it on the replay in particular, and if anyone's joining me live, go ahead and give the video a like, and don't forget to go and check out our other videos on the channel. We talk about women's health. My goal is to teach you all about your bodies so that you can live well. Okay, so let's get started. We're going to go through, I've got 5 questions primed for today's live class. So let's just get started with the first one. I'm going to pull up my notes as well. So this is the first assumption where people say heavy menstrual bleeding is a normal part of a woman's lot. She just has to, deal with it. So let's look at that. First of all, what is heavy menstrual bleeding? It's a term that we use to describe heavy periods that significantly affect a woman's quality of life. Now, we all have different types of periods. Some of us have heavier periods than normal. So when can you say a woman has heavy menstrual period? And by the way, it's also known as menorrhagia. So just in case your doctor talks about menorrhagia, this is what they're referring to. It's one of the commonest reasons that a woman will go and see her doctor, whether her GP or her gynecologist. And studies suggest that one out of 20 women, just think about that number, 1 out of 20 women have heavy menstrual bleeding for one cause or the other. So yeah, we have different types of periods. Some women have lighter bleeds than others, but there is a particular instance where any woman will experience heavy menstrual bleeding, and then it's just too much. So some examples, some scenarios that we would say this is heavy menstrual bleeding are, for example, if you're flooding every day with your pads and your towels getting soaked literally within an hour, literally within minutes, you're flooded. That flooded means you've lost so much blood that your pads or tampons are soaked within an hour, within minutes. That's heavy menstrual bleeding. Another scenario is if you're passing very heavy or very large blood clots. Now, blood clots, that fleshy, dark colored material that you see if you're bleeding heavily, tells us that you're losing a lot of blood very quickly. So for you to have large clots coming down from the vagina, from the private area, says there's a lot of bleeding that's going on to cause or to form those clots. So that is another clue that you're having very heavy bleeding. You shouldn't have large clots that are as big as grapes or as big as oranges. That is not normal. So if you're experiencing those, whether on the first day or second or whatever day of the period, and it's going on persistently, that's a reason to visit your doctor. Okay. Number 3 scenario, if you have periods that last over 7 days and they're very heavy. So heavy could be any of what I've mentioned already. You're flooding or you're soaking your pads quite a lot, and within 2-3 hours the pads are soaked, and you're doing that every day and it's going on for more than 7 days. That's heavy. That's quite a lot, and it's good to see your doctor. Another scenario is if you're having bleeding, and that applies to number 1 where I talked about flooding and heavy periods. That means that you change your pads or tampons every hour. If you're bleeding and it's soaking through to your outer clothes, or soaking through and staining the bedding or the chairs or whatever, that is heavy bleeding. So you've got on a pad, or you're having to wear or double or triple your pads because of your flow. That is heavy bleeding, and I suggest that you should come and sit down and talk to us about that degree of bleeding if you're experiencing it. And another thing that could indicate that your bleeding pattern is normal, because we'll talk about it a bit later. Some people might have heavy bleeding from when they first started their periods, and they become used to it. They become used to it. They think this is it. They may have spoken to somebody, their mom or an older aunt or sister, and this is what happens. Women have to bear with it. and they haven't come to the doctor, but they're experiencing tiredness. Very tired, they're fatigued, any little thing, they're tired, they're exhausted, and that seems to be getting worse over time, or they're experiencing shortness of breath. That is a clue to possible anemia. Big red flag. Please come and sit and talk to us if you're experiencing any of those scenarios. So heavy menstrual bleeding is not normal. It is not part of a woman's lot. If you're experiencing that, please come and sit and talk to your doctor. Let us have a chat about your symptoms. Let us know when it started and so on, so that we can work out what is causing it and how to treat it. So that's number one, debunk. It is not part of your lot. You're meant for much better than that. Do not endure heavy menstrual bleeding. Let's try and work out what the cause is, so we can look at the treatments and get you on a better path to do what you need to do in your life. Okay? Don't forget to like this video, please. Let me just put my tick. I always forget to put that on. Don't forget to like the video and subscribe. I intend to, it depends on how this goes. I'm looking at starting on doing a little bit of a series on this topic, but I wanted to start us off on this sort of just a baseline discussion about heavy menstrual bleeding, see how it goes, and then take things from there. So there might be a couple of more videos coming up on this subject, related to this subject in the future. Okay, so let's go on. The second assumption is that heavy menstrual bleeding is always because of hormone imbalance. Hormone imbalance. That is everybody's favorite cause of so many different problems. Okay, don't get me wrong, okay? Yes, hormone imbalance can cause a lot of different issues. And yes, it can be a problem in heavy menstrual bleeding. So yes, it is true. Heavy hormone imbalance is one of the causes. But hold on, okay? Because before you're tempted to go and start taking one hormone or the other because you think it's hormone imbalance, I need to let you know that there are several causes of heavy menstrual bleeding. See, how many fingers have I got up? 10. Okay, you're going to count with me while we go through the different causes. I'm going to look through my notes because I can't even remember all of them off head, but we're going to go through them and you will tell me how many we ended up with at the end. And the reason I'm doing this is because I'd like us to move away from the idea that this condition is hormone balance. By the time I take one tablet here or the other, it will get better. Many women waste time and resources doing that, and it's frustrating doing that instead of coming to their doctors to work out what is going on. So number one, hormone imbalance. Let's put it on our list. Okay. Number two, ovaries that are not functioning properly. Dysfunctional ovaries, for example, what you get with PCOS, that is polycystic ovarian syndrome. I've got a few videos on the channel on this topic, so please go and have a look if you don't know what it is. It can cause irregular bleeding. Sometimes it could be heavy bleeding. Sometimes it might be scanty, but dysfunctional ovaries, an example of which is PCOS, can cause that. Number three, uterine fibroids. So we're talking about the possible causes of heavy menstrual bleeding if you're just joining us. Number three, uterine fibroids. Again, we have long list of several videos in the channel. Lovely playlist where I've curated so many different topics, questions around fibroids, what they are, treatments, what causes them, blah, blah, blah. Please go and have a look, okay? Number four now is endometriosis. Endometriosis is a condition that affects women. It's one where the tissues that happen inside the womb lining, tissues of the womb lining, appear in other parts of the body, most commonly in the ovaries or fallopian tube. Now, this condition can cause a lot of problems. It can cause heavy bleeding. It can cause painful periods, pelvic pain, and we're not as good as we should be at diagnosing it in women. We're getting better because awareness is getting more and more about the condition, so we're getting better. But women with heavy menstrual bleeding, pelvic pain, painful periods, we must always think of endometriosis. So it's an important condition, okay? That's number four that we've got up to. Number five is polyps. So a polyp is just simply tissue, extra tissue that's formed in a part of the body. Polyps can happen anywhere. You can have a tag, some part of a skin tag that's like a polyp. But happening within your womb or in the cervix, you can have a polyp and it can lead to heavy menstrual bleeding. So that heavy extra growth of part of an organ or tissue is what a polyp is. And when it happens in the cervix or in the womb, then you have a cervical polyp or you have an endometrial polyp. I have just done a video on common conditions that you can find that affect the cervix, and I talked about cervical polyps. So please go and take a look at that one just to understand the condition better. So we're now at 5. Number 6 is adenomyosis. Adenomyosis. Now, that is something similar to endometriosis. Endometriosis, the womb lining is going outside the womb and traveling to other parts of the body, like fallopian tube or the ovary. In adenomyosis, the womb lining, the womb now is divided into different layers. You have the inside lining layer, then you have the muscle layer. So in adenomyosis, that lining that belongs within the inner part of the womb travels into the muscle, and that can also cause problems, amongst which are painful or heavy bleeding. So that's number 6. Number 7, intrauterine contraception. For example, the copper coil, as just an example. Not in everyone, but it is a recognized cause of heavy menstrual bleeding. It might happen when you first have the coil fitted and then it settles down, but some women also have experience where the coil just causes them horrendous heavy bleeding until it's taken out. So that's another cause to be aware of. Where are we now? We're at number 7. Next, we're going to look at number 8. We're looking at complications during pregnancy. So heavy menstrual bleeding can happen during pregnancy for one reason, for whatever reason. It is possible that the woman is experiencing heavy blood loss because she's pregnant. Then what about cancer? So we're now at number 9, reason number 9. Cervical cancer or womb cancer, if you separate them, we're now at number 10. So cervical cancer, womb cancer, those are also causes of heavy menstrual bleeding. They can cause irregular periods, irregular bleeding pattern, and sometimes there could be floods of blood loss, which is heavy menstrual bleeding. So we're at number 10. Next is bleeding disorders. Bleeding disorders, for example, conditions where people's platelets don't clot properly. And so that person is at risk of losing a lot of blood with very simple cuts, very simple injuries. They bleed a lot. Such individuals can also experience prolonged heavy bleeding coming from their periods. So that's another potential cause of heavy menstrual bleeding. Okay. Next, medications. We've just talked about the coil. The commonest medications that will come to mind when we're thinking about heavy menstrual bleeding are things like your pill, the progesterone-only pill, for example, and the depo. That's the depo injection shot. For some women, now not in all cases, some women do not experience side effects. We're all different, but I wouldn't be surprised if somebody came and said that they started the mini pill and then they're experiencing heavy bleeding, or for example, starting with the depo. A lot of the time, these side effects do settle down. Okay, they do settle down after a few weeks or months. And that's why we doctors, when we start you on these conditions, we say if the bleeding is not too troublesome, give it a few months, give it about 6 weeks to 12 weeks for the levels, your hormone levels to calm down. We've just introduced a method into your system. Give it some time to settle before you say that, well, this is just, I can't cope with this. Unless it's just ridiculously abnormal from the get-go, in which case, please speak to your doctor. We don't have energy. We're not primed for suffering. So really, you should speak up if you're struggling with it. So according to my list, we're now on number 12. Okay, so the 12th potential cause of heavy menstrual bleeding is when you first start having your periods. So this is known as a menarche, as a young lady or young girl just going through puberty and she starts her periods. Within the first 12 months, she might have irregular cycles or irregular periods when at some point her ovary releases an egg and then she has a menstrual bleed. The next month it might not do so, and then the following month there's a big collection of bleeding that comes out because she missed a cycle the month before. This pattern of irregular bleeding, which can be heavy at some point, or there might not be anything for a few weeks, this type of bleeding is because the menarche it's just starting. The periods are just starting. It's going to take some time for the hormones to come to a balance. So the response of her ovary to the hormones coming from her brain, directing the hormones in her reproductive tract, they're still going up and down, they're still fluctuating. With time, they will come to a nice level pattern, and then she would have her regular monthly periods for most of us. But for that first 12 months, some girls, not all girls, some girls may have 1 month where there's a bleed, the next month nothing happens, then the month after there's a very heavy bleed, and then an irregular pattern. And after some time, usually about 12 months, it does settle down. Okay, so we say those are a cycle that can happen in a young girl who's just starting her period, which is menarche. I think we're at number 13. I hope you're keeping count. But anyway, we have already gone past my 10 fingers. I just wanted to prove to you that when you hear heavy menstrual bleeding, please don't just think of hormonal imbalance. But we're number 13, and number 13 is what is the one that doctors, after we've done all the tests and we haven't found anything. It's not fibroids, it's not endometriosis, it's not cancer, it's not pill, it's not coil. So we haven't found anything. It's not polyps. We haven't found anything. And then it's a term that we use for this condition. It's known as dysfunctional uterine bleeding. So there hasn't been any abnormality detected, even when you have your scans and they measure the width of the womb, or they do the hysteroscope and they look, and then they get tissues from tissue cells from the womb to look under the microscope. Nothing is found. We refer to it as dysfunctional uterine bleeding. And the suggestion from studies is that it may be because of some chemicals. There's a special chemical known as prostaglandin that we think may be affecting the womb. Some women produce it a bit more than others, and that might be why their bleeding pattern is so irregular, so heavy. Or it may be that their womb just isn't managing to control bleeding as well, as effectively as it should. But the key thing is that they've had their tests done and nothing abnormal has been found, and it is treatable. Okay, so it can be treated. We're still talking about causes. We've not finished. Pelvic inflammatory disease is my number 14 here. Now, that is a serious infection. Please take it seriously. Usually as a complication of sexually transmitted disease that you might pick up from a partner, and then the germ passes up from the vagina up into the higher reproductive tract. So that means it gets through the cervix, into the womb body, can even travel into the tubes. So a serious condition. It must be treated, because it can cause, not only can it go ahead to spread from the pelvis and the womb into the rest of the abdomen and cause sepsis, which is a general infection. That's the worst case scenario. But if it doesn't end up healing, it can lead to infertility. So we don't joke with PID, or pelvic inflammatory disease. And one of the problems that it can cause is heavy menstrual bleeding. Now, please watch my video. I've got a couple of videos on pelvic pain, and in one of them I do talk about PID. So if you want to learn more about it, then please go ahead and watch that. Endometriosis is a womb inflammation or irritation. Usually we use that term if there's an infection, commonly after pregnancy, perhaps after cesarean section. There's an infection within the womb. So a woman comes up with a vaginal discharge. This is just one example. Vaginal discharge that's offensive, pain in her womb, pain in her lower abdomen or pelvis. She may have an endometritis, and then that can contribute to heavy and irregular periods if it's not properly treated. I've mentioned womb cancer already, and just so these are causes we're well past 10, and this can affect younger women. It can affect older women who have polyps or fibroids, who are approaching menopause, may have heavy bleeding. So please, I want to make sure that we're very clear that heavy menstrual bleeding is not always down to hormone imbalance. So if somebody is trying to sell you some pills to say take these and that will stop the bleeding, no. Dr. Sylvia says no. There are more than, she's got 10 fingers, more than 10 causes of heavy menstrual bleeding. Please go and sit down and talk to your doctor. Let us know what's the cause so we can treat it properly for you. The third assumption is you only need a scan to know the cause of heavy menstrual bleeding. hopefully, now that I've talked about the possible causes, and I haven't got there's a long list, but I've just gone through, I think we did about 16 or 17. We've managed to go through these so you can tell that what's the best way to put this? The scan is just one of the tests that you can have to diagnose the cause of heavy menstrual bleeding. So when you go to your doctor, let's just go through just a little overview of what your doctor will do if you go to them and say you've got heavy menstrual bleeding. So first of all, your doctor needs to understand what is the pattern of your bleeding. When you say you've got heavy menstrual bleeding, what do you mean? How many pads or tampons are you using? How often are you changing them? Then when did this problem start? How long has it been going on for? How long does it last for? Okay, was this a problem that started when you started your periods, like when I said menarche? Or is it something that, I have had normal periods for 5 years and all of a sudden my periods have changed? So this is the kind of information your doctor will want to get from you. And they'll also want to know, because we said heavy menstrual bleeding is significant bleeding or menstrual bleeding that affects a woman's quality of life. So they want to know, how is this affecting you? And this is the time to say, because of this bleeding is so heavy, I'm having to take time off work. It's embarrassing. I'm flooding the chairs at work, or I'm flooding the bed sheets or the mattress, or or in school. And these are the things that your doctor wants to understand clearly, how just the impact that it's having on your activities. So please be open about about any effects that you're experiencing. We would also want to know if you're having any other symptoms, for example, a vaginal discharge. We talked about PID. So is there vaginal discharge? Are you getting pain around your abdomen, or pain around your pelvis or tummy? Are you having problems passing urine? Is it stinging or burning when you go to pass urine? Are you experiencing accidents where you're leaking? Because we're looking at possible causes. So we're going to ask everything related to your genital area. Okay, so your doctor will ask those questions. Don't be surprised to hear about such questions. Your gynecological history, your doctor wants to know normally, what are your periods like? I always say to my ladies, please make sure that you're recording and have it in your app or in your diary, or write it somewhere. What's your menstrual flow? When was your last period? What we want our women to say to us when was your last menstrual period? Oh, hang on, let me just check. And it's there. You put it on your phone or put it in a book somewhere. You've got it there. So keep track of those things. Keep track of any changes. So what's your period like normally? Have you had any gynecological procedures, operations? Have you had any treatments? Have you been pregnant before? Any terminations? Have you children during childbirth? Was it by vaginal birth or C-section? Were there any complications? This story. So we haven't even started with tests. We're still in the story. We want to know everything because the list is more than my fingers. So we want to know everything so that by the time we're thinking of the tests, we have a focus. We're looking in a particular direction. That's the help that all this information you're giving us will then provide. Sexual history, very, very, very relevant. So this is not the time to be shy. This is your health, okay? Any sexual partners? When last did you have intercourse? Is there pain during intercourse? Have you had a sexually transmitted infection before? Was it treated? Do you use condoms during sex? What contraception do you use? And so on. Those are the kind of questions. Then, smears, your cervical smear history. Did I mention that? No. Cervical smear history is important. Have you had a cervical smear recently? Have you had your HPV vaccination? Those details. We'd also want to know about your general background. Now, this is just an overview. There's so many questions to ask, and if you want me to, I can do a separate video when we're looking at the history taking the bit so that you're prepared when you go and sit with your doctor to have this discussion. General questions. How are you feeling generally? So outside of the bleeding, are you losing weight? Remember I talked about tiredness and fatigue. Are you feeling unduly tired? Before it's a couple of hours at work and you're exhausted, you want to go to sleep, you want to lie down. Are you getting breathless, more breathless than usual? You just walk 5 minutes, just walk to the coffee room or go up 2 flights of stairs and you're panting for breath. And you weren't doing that 3 months ago. Red flag. Okay, so general questions that your doctor would also ask. Any medical problems, maybe do you have high blood pressure? Do you have other medical conditions? Family history. And your doctor will also ask about the standard things. Do you smoke? Do you take alcohol? Just so that we get a good picture of you, and we can then have an idea of where this problem is coming from. We've not gotten to the test yet. We're going to get there, but this is part of the workup. And this is why I want to get us away from, oh, it's only scan that can answer the question. Other things are important. So after the test, after the questions, your doctor should examine you. Examination can include examining of course, the general examination, but also examining your abdomen. So they want to have a feel of your tummy, look at your tummy. They might be able to detect the swelling. For example, if somebody has fibroids, or if you're having pain, that might give a clue as to what's going on. Then an internal examination. Don't forget to ask for a chaperone if you need one. An internal examination where they want to examine have a look at the vagina, have a look in the cervix, see if the cervix is tender or painful. If there are any changes, please go and check out my video on conditions that affect the cervix to understand what I'm talking about. And at the same time, when they're doing the internal, they can take some swabs to check for infections. So we've done the history, we've got the story, we've examined you. Next, we will look at tests. Blood tests, pregnancy tests, full blood count, to check if you're anemic, we'll do that. Then, of course, an ultrasound scan. An ultrasound scan can tell us if there are fibroids present. Of course, that's important. But what I'm trying to get your head away from is, oh, it must only be a scan. Okay, now, apart from the scan, there are other things that they could do, because your scan could come back normal. So if it comes back normal, what next? Next would be perhaps refer you to your gynecologist, where you can have other tests like a hysteroscopy. That's when a tube with a camera is put into the womb to have a look round at the womb. So it gives you better view than the scan, because you're actually looking into the womb itself. And in many cases, they can take a little piece of tissue called a biopsy that you can send off for test, which will be useful. For example, looking for abnormal changes that might mean cancer and so on. So big range of tests that you can potentially have and that you should have if we're investigating for different causes of heavy menstrual bleeding. So I hope that's helpful to debunk that idea that you only need a scan to know the cause of heavy menstrual bleeding. Okay, next one is that heavy menstrual bleeding can only be treated with hysterectomy. That is a lie. Tell them, if anybody is trying to say that to you, that's not true. Or that you must have a hysterectomy to treat heavy menstrual bleeding. That's not true. The treatment depends on the cause. It depends on the cause. We've gone through the treatments. I'm sounding like a broken record now, but we've gone through the different possible causes. So if it's an infection, for example, it needs antibiotics. If it's fibroid, it needs different treatments, medical options for treating fibroids, surgical options for treating fibroids, which can include removing the fibroid, that's the myomectomy, or depending on the woman's situation, it could be a hysterectomy, depending on the woman. But you also have non-invasive methods for treating fibroids, like uterine fibroid embolization, and different things that can be done. So the answer, because somebody is having heavy menstrual bleeding, is not straight to the operating theater to remove the womb. That's not true, okay? Treatment, when doctors are considering treatment, we also look at your current situation in terms of children. So for a woman who does not have children, she's maybe in her early 20s or late 20s and has not started her family, you're not going to be, and this is a discussion that we'll have, nobody's going to bring first forward that, okay, let's have surgery or let's have an operation. Even in terms of medical treatments, you have hormonal and non-hormonal treatments. And for somebody who hasn't yet started their family, you're likely to be offered non-hormonal treatment in the first instance. So there's a wide range of discussion of options that you should have. And it all depends on your symptoms. It depends on your preference. It depends on, have you started or completed your family, and so on. So there's not one rule that somebody with heavy menstrual bleeding will end up with a hysterectomy. So that's one assumption I wanted to debunk. And lastly, we will look at this question, which is, women with heavy menstrual bleeding can't have children. So I want to particularly debunk that. It's related to the fourth point, because they're saying that, well, because they're going to have treatment with hysterectomy, so they can't have kids. That's not true. Women with heavy menstrual bleeding can certainly go ahead to have children. The key thing is we're looking at the cause of the condition. Once we've identified the cause, in many cases, it is treatable. Many cases it's treatable. So never assume. You have to sit with your doctor, whether it's your GP or your gynecologist, to thoroughly explore the symptoms, do the tests, so that we can work out the right treatment. So guys, that is, I wanted to provide, let's start that basic, let's get that basic overview on heavy menstrual bleeding. Depending on you guys, your feedback and comments in response to this video, I may start doing a few more targeting specific areas. So if you're interested in, okay, I want to talk to my doctor about heavy menstrual bleeding, what should I expect? What are they going to ask? Please, then let me know. I'll do a video around that area. And if you want to know heavy menstrual bleeding, common causes in young people, common causes in older women, I'm happy to go into that. If that's what people want to hear, let me know. Or what are the treatment options of heavy menstrual bleeding? Let me know your thoughts in the comment section, and I'm happy to go into those areas. So guys, we're going to round up the stream. Thank you so much for joining me today. It was a little bit later than our usual broadcast time, and I'm sorry for that. But thank you so much for liking the video. Please like it. Drop a comment. Let me know your own experience as well of heavy menstrual bleeding. How was it diagnosed? How early was it diagnosed? What treatment did you have? Let us share experience, so that we can all learn from each other and do better in our lives. Have a lovely weekend until I see you. Oh, I released a video. Happy Children's Day. Happy Children's Day. Not many children should be watching this stream, because we're discussing, we're not discussing kids stuff, but many of my viewers have kids. So happy Children's Day. Hug your children. Develop a great relationship with your children. Yesterday, I published a video looking at 5 reasons parents find it difficult to talk to their children about sex, puberty, wet dreams, periods, and so on. And this Children's Day is a good time to remember our kids and think about that discussion and why you're having difficulties having that discussion with your child. I gave a few examples. I'd love you to go and watch that video and tell me what you think, and tell me your own points. Tell me what you think might make it difficult for other people or yourself, and what you've done, how you've gone past it, how you've tackled the discussion with your kids. I'd really, really love to hear from you guys. All right, so my darlings, have a great weekend, and I will see you again, same channel, about the same time next week, Friday, in a live stream, or during the week on one of my other videos. Be blessed. Bye-bye.